Hello, my name is Philip Larkin, and as President of the European Association for Palliative Care, I'm delighted to speak to you this morning on the event of your 10th Annual Congress. I bring the greetings of the AIIHPC and the 57 member associations across 32 countries whom we represent. I'm speaking to you today from Our Lady's Hospice and Care Services in Dublin, one of the oldest hospices in Europe, where I hold a joint clinical academic nursing post. As a nurse in practice, and in my role as the AIIHPC President, I'm very aware that here in Ireland, palliative care nursing as a specialist discipline is well developed. We've had clinical nurse specialism here since the late 1990s and advanced nurse practice roles since the mid-2000s. Palliative care as a medical discipline has been a speciality here since 1993. So I'm very pleased to learn that there will be a new national council to develop the criteria for specialist palliative care nursing in Denmark. This is an important landmark in your professional development, and I look forward to seeing your success in this endeavour. As you may be aware, the AIIHPC has always supported the role of nursing in palliative care. Our bylaws require that at least one nurse must sit on the board of directors, and we've had 2 task forces in palliative care nursing. The first in 2004 prepared a series of guidelines for practitioners, academics and managers to try and understand exactly what a nurse should do who has completed a palliative care education and training programme. In 2014, a new task force was set up, led by Dr. Sandra Pereira from Portugal and Professor Annika Franke from the Netherlands, to see how those guidelines had impacted on nurse education in the EU and what developments had happened in the intervening 10 years. I think we will see the results of that quite soon. We are aware that a strategic shift has changed in relation to the development of competence in practice. Here in Ireland, we've developed a series of multidisciplinary competencies in palliative care, including nurses working across a range of clinical areas where palliative care may be needed. General care, older person care, mental health, intellectual disability, paediatrics and midwifery, including neonatology. As you begin to develop your ideas and vision for palliative care specialist nursing in Denmark, your colleagues across the EU who've been on this journey will be pleased to support you. We wish you every success in your endeavours. The work of nursing in palliative care, not least because they're often the largest workforce in the discipline, is an essential component in delivering the core message of Cicely Saunders' vision, to live until you die. Unfortunately, in my AIIHPC role, I'm aware that for many nurses, their contribution to palliative care is not always valued in the way it could be. In many countries, nurses are unable to access higher education opportunities. The possibility of master's and PhD studies is limited, even in countries which have excellent university provision. Even with those qualifications, the professional opportunities for nurses in terms of clinical specialism and advancement is limited. There is a need for the voice of nursing to be heard in terms of who we are and what we do for the optimal patient and family care that we bring. In my presidency, I hope to bring some of those issues to the fore and find ways to strengthen the place of nursing in palliative care. We can do this by realising that we all speak to the motto of the AIIHPC, one voice, one vision. If we can aspire to that, despite the difference in our national systems, and find ways to reach out to each other in our hopes and aspirations for palliative care nursing, then we will achieve our goals. We have a unique role in palliative care, one that we should nurture, cherish and be proud of. So it is with great pleasure I wish you an excellent conference, much success in the important developments that face you in Denmark now for specialist palliative care nursing, and I hope to see many of you at the 15th World Congress in Madrid from the 18th to the 20th of May next year to hear about your progress. Farewell, goodbye.